patient is having heart attack or any heart related problem. So at that time we used to do CPR, that is cardiopulmonary resuscitation. Okay? Now that is all things which you will come to learn gradually and slowly. Okay? What exactly is the thing is, some people have worked in casualties and all. So basically there will be other departments where you will be posted. Some will be posted in casualties, some will be posted in IPDs, wards and all. Okay. First thing first, you should know that you have to be with the senior. Your senior sisters will be there to assist you. You know, observationship is most important thing. Observation. Okay. You should never jump to it. Okay, I know, I'll do it, I'll try it. First, observe what is going around. What are the things they are trying to do? How they are taking the vitals. What are things which we should know when we are seeing a patient? You know? So if a patient coming in casualty with unconsciousness and you don't know what to do, don't panic. Just inform the senior staff nurse. Okay. So what all things will be required in that situation? Checking up the vitals, very important. Checking up BP and sugar. Unconscious patient will not tell you, okay, I'm having this problem. But then it is your duty to assess. Keep writing down. What you need to do is keep writing down. Okay. These are the small points you'll be taking care of this. When you see an unconscious patient, what is the thing that comes into your mind? Maybe the sugar is low. Maybe the sugar is very high. Maybe the BP is too low. Maybe the BP is very high. Okay. So these are the things which you will have to take care of. What you should do it before you inform the resident doctor, before you inform the consultant. These things you should be ready with. The vitals you should be ready with. Because the consultant or the resident doctor will be coming, they'll just immediately look up the vital. Because that thing will give them a picture what should be the next plan of action for the doctor. You know? So you should be ready with the vitals. A small baby kid is there. What do we do? For kids, we always check the body weight of the kid. Okay? Because for adults, it is a fixed dose. But for kids, the dose is calculated on the body weight. Okay? So always for pediatric case, check the weight first. Okay? Then go ahead with the other vitals. Okay? What exactly is the patient come with? Check for, ask for the complaint. What is the complaint? Basic complaint. Okay. Suppose the patient says, I have got fever. First thing first, you should come into mind, check the temperature. Along with that, put the thermometer. Along with, don't wait for the temperature to come, then you will. At the same time, you should keep checking for the other vitals like saturation. Put a saturation probe, pulse oximeter or a saturation probe. Check for the other vitals. So that it should be a multitasking. It should not be like you get temperature first, then you check the BP, then you check the other vitals. Do it simultaneously. So that your work should be faster and your report should be ready to hand over to the concerned resident doctor or the consultant. These things will be required. What exactly has to be done in the casualty, in emergency department. Okay. Other things, when you go into the ward, you should see first thing first, what most of the nurses they don't do is they don't read the case sheet. First read the case sheet. What exactly the patient come with? Because you will be giving a handover. Suppose you will not have been given the handover. You should read the case sheet. What exactly the patient come with? Read her previous reports. Okay. So at least you will have a thing in your mind, okay, patient has such and such problem, report is ready. Or report has to be given, sample has to be given. So those things you should keep a track for your thing, because when we go for any rounds and all, the consultant always asks for report. Based on the report, the treatment will be planned, right? So that is important. Always read the case sheet of a fresh patient. Next day, if the same patient is treated, check the progress in the nurse's note. What exactly was given, what time the patient had temperature, what was the saturation, was the saturation falling, was any nebulization, was nebulization. These are the things which will be taught to you as you go ahead with the thing. So basically I wanted to tell you all these things, what exactly is your duty as a staff nurse. is to first thing first assess, okay, what the patient has come with, what is the complaint. Second, do your work like vital checking and other thing. Third will be like, as patient is like for dressing and all, other staff, junior staff will be there. Just observe what are the sterility procedure they are doing. Okay, sterility is very important. Very, very important. Why? Because the patient has already come in sepsis. You should not touch with bare hand to the patient, so that you should not infect the patient with your contaminated hands. So sterility is very important. Okay, those things will be taught. How you have to take the things in sterile procedures, like how you have to get the gauze piece. Should not touch with hand. They will check the forceps and other things to get the gauze piece or any sterile material which can be used for dressing purposes and for the other stuff. So these things will be taught and all. So I think that is all about the thing, right? So the staff senior nurse will be there, will be teaching you technicality, what has to be done, what you should do. Okay? All right. Thank you so much.
Thank you, sir.